I have to shift from my Teams meeting mindset to Zoom meeting mindset. So, and you probably have other formats you go to as well, right?
Okay, the live stream's up and running.
Thank you, Krista. All right, good morning, everybody. Thank you for joining and be on time. Hope you and your families are doing well. If you're okay, we'll start the meeting. And thanks, Stephen, for your help with organizing everything, and as well as Marie for helping to get this going. Krista, for your work on the IT side and organizational side, and everyone for your help in keeping the community safe and your efforts as ongoing committee members. Does everyone have a copy of the agenda? Or if not, we'll refer to that and we'll start the meeting. Let's go with a roll call. And to avoid confusion, if you don't mind, I'll call you. Otherwise, everyone's going to be talking over everybody. And we'll do the roll call, and then after our call to order, which we just had, and then proceed with the meeting. Sound okay? All right. So I'll just kind of go with my list. Stephen Senor, the committee chair, and also work with Cascades Tissue and teach a class over at UW Stout. So again, welcome everybody. Thank you for joining. Krista, would you like to introduce yourself?
I'm Krista Vinn. I work for Dunn County IT.
Thank you, Krista. And Jim Tripp?
Good morning, Jim Tripp. I'm a supervisor with Dunn County Board, chair of the Judiciary and Law Committee.
Thank you, Jim. Marie?
Marie Marty. I work for Dunn County. I am currently at the Sheriff's Office, but I used to be in emergency management.
Okay, thank you, Marie. And Stephen?
Hi, good morning. Stephen Findlay, Dunn County Emergency Management Coordinator.
Great, thank you, Stephen. And Brad?
Brad Ludke, 3M Menominee.
Thank you, Brad. And Brian? Or Byron, sorry.
Good morning, everybody. Brian Moore, Dunn County Aries Races.
Okay, thank you. And Jeff Beagle?
Jeff Beckel, Safety Manager at Cardinal Glass. I also have Matthew Crow with me.
Thank you, Jeff.
Engineering Coordinator here at Cardinal Glass.
All right, thank you, Jeff. And Jenny?
Good morning, Jenny Legaspi with the American Red Cross. I'm one of the disaster program managers in the state.
All right, thank you. And Kate?
Morning, Kate Carlson, Vice Chair with Chubb Global Risk Advisors.
Great, thank you. And the best health director in the world, KT?
Thank you for that. KT Gallagher, I'm the Dunn County Health Department Director.
Great, thanks, KT. And things are jumping around a bit. See if I didn't miss anybody. Jason, would you introduce yourself, please?
Yes, I'm Jason Barneson, Lieutenant here with the Menominee Police Department.
Thank you, Jason. And Tara?
Good morning, I'm Tara Verdon. I'm with Mayo Clinic Health Systems, and I'm the Safety Emergency Management Coordinator.
Thank you, Tara. And Ryan? Ryan, Martin, if you could introduce yourself, please.
Yeah, good morning, everyone. Ryan Martin, EHS Manager at ConAgra Brands.
Thank you, Ryan. Did we miss anybody? I think we had it. Or did I miss anybody?
Just me.
Sorry, Kelly.
No
we
problem.
Kind of introduced yourself, so I figured we were good.
Kelly McCullough, County Board Supervisor, Chair of the Highway Committee, and as of about an hour from now, Menominee City Council as well.
Oh, congratulations. Thank you. Do we miss anybody else? No, I think we're good to go. Thanks for taking the time again remotely because of the situation. It's been a challenge for all of us. So thanks everybody for joining. Sarah, we're doing our introductions. Would you mind introducing yourself, please?
You might want to ask her again. She was just getting connected.
Is it me?
Yes, hi, Sarah.
Oh, hi, Sarah Schaefer, supervisor at Mayo Clinic over here in Menominee,
Great,
the emergency room. Thank you.
Okay, thank you. And I think that's it, unless somebody else just joined.
The sheriff just finished another meeting and jumped on here.
Okay, thank you, Sheriff. Could you introduce yourself, please?
Kevin Big, Sheriff, Dunn County.
Thank you, Kevin. All right, I think we're good. So the next order of business is a review of the previous minutes, and those were sent out. Thank you, Marie. If you could, then we'll introduce Tim. You could take a look at the minutes and see if you have any questions, you have any comments. If not, we can entertain a motion to accept the minutes as is. Thank you, Jim. You're on mute, but I saw your hand go up. Do we have a second to accept the minutes?
Kevin Big will second that.
Thank you, Sheriff. All those in favor, raise your hand. I guess that's probably the best way. Opposed? Okay, everything's good. And we had one more person join us that I believe introduced Tim. Could you introduce yourself, please?
Tim Koleski, Menominee Fire Department.
Welcome, Tim. Thanks for joining. Okay, the next order of business is the City of Menominee Type 3 Hazmat Report, team update. Stephen, can you give that to us, please?
That'll be Tim's report.
I'm sorry, Tim, can you give us an update, please? Thank you, on the hazmat report.
I guess I logged in just in time, huh?
That'll teach you.
Well, we're doing a lot of upgrading with the hazmat team. We just purchased a new trailer. We got rid of the 1996 Ford pickup truck that was a manual transmission that none of the new kids could, I say kids, new employees couldn't drive. And we realized that we were overweighted with that trailer. So we got right now it's on auction, or just got off auction. And the trailer and the truck are sold, and we bought a new one that would hook up a bumper hitch to all the other vehicles that are within our department. As of today, all members of the fire department, including the new members, are hazmat technician trained. And we have recently just done a tabletop with a train derailment with the members, and also we used our chlorine gas prop to simulate an emergency with dry ice, and training with certain individuals to mitigate a situation if it arises. So we've been busy. We've done what the heck you want to call it? Went through all our equipment, and we have a updated list of all our equipment that we have right now, and all the stuff that is needed to be replaced or updated. So it's been kind of busy on the hazmat end without incident. Let's put it that way.
Okay, thank you, Tim. Do we have any other exercises planned, or any perhaps joint drills or events that are scheduled?
The 26th of this month, I'm going to go up to Hudson, and they're part of our Type 3 team through the state, or we are their Type 3 team. I'm going to train those guys how to do a decon line. I know the trailer's been up to Boyceville, and Boyceville Fire has went through our trailer and also has trained on setting up a decon line. But right now it's just with this whole COVID thing, who knows what's going to go on.
Right. All right, thank you, Tim. Any questions on the hazmat update or Tim's update?
I might add that the grant season is opening up here, and by 14th of March, we have to have an indication into the state that we'll be applying for grant money to help the hazmat team purchase some expendables and other gear this year, as we've done in past years.
Okay, thank you, Stephen. Other questions or comments? All right. And Randy has joined us. Randy, we did the roll call. Would you mind introducing yourself for people who might not know you?
Sure. Sorry about being tardy. Randy Idy. I'm the Public Works Director for the City of Menominee.
Okay. Thank you, Randy. Yep. All right. We'll continue on with the agenda. And the next item for review would be the budget discussion. If Stephen, you could take us through that, please.
The only, I have no report other than there have been no expenses other than wages and fringe for the period from December till now.
All right, thank you. And the next item was on the spill updates. And Tim, I believe you said we didn't have any, but is there anything to report, Tim or Stephen, on that?
I do. Actually, I have several here to report, to follow up on mostly. In December, we had a spill in Rock Falls where a transport truck was transferring fuel to the Senex, the station down there in Rock Falls. It's been clean. It's a 40-gallon spill. It's been cleaned up and closed out by the DNR. In January, that was closed out. January 4th, there was a 150-gallon diesel spill on the interstate, mile marker 42.5. That's still an open case. It's been cleaned up, but the DNR is still working on the case to close that one out. January 11th, there was a 5-gallon heating oil spill in town of New Haven at a residence. It was a spill into the basement. It was a homeowner condition. Homeowner is taking care of the cleanup on that one. March 3rd, near Boyceville, there was some logging equipment out in doing some work, and it had rolled over and burned, and figured a loss of 100 gallons of diesel fuel and 30 gallons of hydraulic fluid. And the report is that most of that burned up in the fire with the equipment. And that case is still open, but pending further remediation. April 5th, a natural gas line break at the Senex on 2320 Highway 25 North. That's still an open case with the DNR, pretty recent one. And the most recent one was April 13th, 2,500 gallons manure spill at an agricultural. There was a spreading going on in a spreading operation in a field, and it's an open case now. Some of that was running down into Rock Creek, into that vicinity. So that's an open case. So that's what I have for a spill report to the state. Other pending ones, we'll address them in June as we go forward with the cleanup and everything.
Okay, thank you, Stephen. Any questions or comments on the spill report? All right, if we could keep the agenda going with you, Stephen, on terms of the coordinator report, please.
Okay. We will have at the June meeting, we'll have some offsite plans will be completed by then. We have a little bit of work to do on. So there'll be 6 of them coming up. Big Rivers Resources, Charter Communications, the cell tower, the AT&T central office right in Menominee, Ole Americas in Boyceville, and Phillips Metasize metal injection molding. We'll have those. Well, that's 5 reports. There'll be 5 to do. I misspoke. So we'll have those ready for the June meeting. And that's the only, let me see here. And the only other item I would have on coordinator of information is there are no proposed membership changes to the committee other than we do have a position open for print media that we're still looking for somebody to fill that position.
Great, thank you. So that makes sense. So the terms of the spill reports, won't have any this particular go around. Is that correct? And we'll just go on to the June meeting for the next ones?
For the offsite report, for the offsite planning facilities.
Offsite, yeah. Offsite, yes.
Yeah, we'll have those ready for, yeah.
All right, thank you. Questions or comments? All right, and Rob has joined us as well, and we'd like to make sure everyone knows you. Rob, would you mind taking a moment just to say hello or introduce yourself?
Oh, hi, represent Rob Sumfield, Sorry Lake, just kind of double booked, actually triple booked, so got in, so thank you guys.
Thank you for joining us, Rob. All right, so if we follow our agenda, if we could turn it over perhaps to KT or other health partners and give us an update in terms of the pandemic and any information you'd like to share with us.
Sure, I'll kick us off and then we
Thank
can
you.
see what our health system partners would like to add. So as we follow our numbers, we are continuing to see a post-spring break uptick in cases. Many of them are travel associated. And then we did have some spread as we had some large spreading events at Easter gatherings as well. So we're at 4,225 cases. We are following 56 of those that are active. We did have an additional death that was reported and went into our numbers today. So we're at 32. The individual had been hospitalized for over 3 weeks. Very sick. We have seen 28 reinfections. About half of those are symptomatic. Many of them are picked up with regular surveillance testing that many of our long-term care facilities do, or people are tested as close contacts as well, or procedure. So out of the total number, not many, but it is of note to understand that it is a possibility, especially as we are seeing now an inversion in the state lab of hygiene's variant and genomic sequencing. So we are starting to invert to where we're seeing more of the variants of concern. And with that, we would expect to see a spike in cases. We are also excited to get more shots in arms. So as a state, we are at about, 38% of the state have had at least one shot, with a quarter of the state's population having completed the shot series. That's fantastic. In Dunn County, we are lagging behind those numbers. So we have about 30% of our population that has gotten at least one shot, or about 23,000 doses have gone into Dunn County resident arms. And then we only have, so we're actually not that far off on our second doses or completed, with about 20% of our population here. And I know that there are questions about that as far as us getting started a little bit later, us having the types of job generators that weren't in those first waves of eligibility, but now we are starting to pick up, and our age demographic. So we are a fairly young county, having representation with a significant amount of Stout students, and they weren't until very recently eligible. Update on Johnson & Johnson. We have suspended our Johnson & Johnson clinics. Per the FDA, CDC, and Wisconsin DHS request, we had provided about 240 Johnson & Johnson doses through the Dunn County Health Department. At the time, we didn't have any other Menominee vaccinators that had gotten J&J into arms. They were going to receive, or had received, and were going to vaccinate with J&J this week moving forward. So the timing was good for that. The surveillance system worked. We're talking about a 1 in a million probability or occurrence, and they were able to pick that up and pause it so that they could explore that further. And then we are seeing very large mass vaccination clinics come online. So Zorn Arena at UWEC, UW-Barron also has a mass vaccination clinic starting, I believe, this week yet. And we are definitely ramping up for a much larger number of doses per day in the state. Any questions for me?
I just have a comment, if I may. Katie, I want to thank you for that. I actually sent Katie a message this morning. I had a question about Dunn County lagging a little bit behind in vaccine administration, and you've answered that, so no need to respond to my email. You've probably got better things to do. So thank you.
I was hoping I could address that. I think that we will see vaccine hesitancy play a larger role, but we've not hit that threshold just yet, I don't believe.
Other questions for KT? I guess just one on my behalf, and we can take any others, KT. Do you see any changes in the protocols in terms of, or just continuing on with the safe practices, the distancing, the masking so far?
So I think non-pharmaceutical interventions continue to be very important because we will have a large proportion of our population that it's unable to or unwilling to be vaccinated. Currently, we don't have a vaccine that's approved for folks under 16. We do know that children can get and spread COVID-19, so it's important that we continue to do those things and model that behavior. So they talk about it as vaccine is not the cure-all or end-all for the pandemic, but it's important that we continue to do those other things as well. We did have, masks work, and our data bears that out. We had a massage therapist who was working mildly symptomatic. They had 10 clients. They were very much masked the entire time. They had no transmission in their clients. They had transmission in their household. Masks work. We're going to continue to ask people to wear masks, stay home when they're sick, even if they think that it is the stomach bug or some kind of allergies. It's really important to not go to work when you're sick, and then good hand hygiene. So I don't think that will change. I think what will change is that the gathering recommendations will continue to get larger as we have a higher and higher proportion of our population here in Dunn County that are in the state that are vaccinated.
Thank you. And the other question, which I don't know if there's an answer to, KT, at this point, or are there health partners, is with some of the mutations that are continuing to spread, did you see that there may be some booster shots or the length of time that the vaccination may be appropriate for? Do you see any changes or updates with that?
Sarah, do you have any updates? Otherwise, I'll shoot from the hip.
Yeah, go for it.
So there is some preliminary conversation about boosters, but honestly, we just don't know. We're not seeing necessarily a high degree of breakthrough infections in vaccinated people, which is a good thing. So we don't know exactly how long vaccine-acquired immunity will last, but that's something that the science is actively looking for data around so that we can keep people safe. But I know that there are initial conversations of what boosters could look like and if they're needed, honestly.
Mm-hmm. Agree. Tomorrow, I know they're doing a mass vaccination at UW Stout. So hopefully we're getting 750 people vaccinated tomorrow. So that would be great. Like Katie said, masks work. We're not seeing the flu this year. We are seeing a little bit of an uptick on COVID right now. But, we're just keeping things prepared, and we're not backing down on anything, just staying prepared for any kind of another surge, which hopefully we don't have. So.
Okay, thank you, Sarah. Any other comments from our health partners, Tara or Katie or Sarah? We're good? Okay, thank you for that excellent update. It's certainly on everyone's mind, and how are we going to move forward, where are we going to go? And these questions are probably coming up daily in your world, so we appreciate the updates on that. Next order of business is member discussion. So we can open it up to anybody here in the meeting in terms of topics that you might have, or questions or comments that you might have, any issues you'd like to raise.
Mr. Chair, if I may.
Yes, Jim.
Not to get anybody's hopes up, but the county is in line to receive fairly substantial COVID-19 relief funding. And at least as far as I know, and there are a lot of unknowns, the favored uses of that money will be obviously for any kind of relief from COVID, either economic or medical, but also to build infrastructure going forward. And I'm thinking that if there are requests or needs for equipment that would help us meet emergency situations, this might be a good time to dust off those plans and bring them out and see if they qualify for some of the funding. And again, no promises, and the questions surrounding this funding are numerous. Nobody is really sure how the funding will be used, but there is a substantial amount of money available, and if you've got worthy projects, especially in terms of equipment, now would be the time to share those.
Thank you, Jim. So in terms of equipment, you're talking about like healthcare equipment, or could it be more broad-based?
I can't answer that question. I'm hoping, though, it'll be a little bit more broad-based and emergency response type activities that require equipment. We just had a discussion about the truck and trailer. I have no idea whether those things would qualify, but I'm hopeful. So if there are other similar kinds of things, I see a glint in the sheriff's eye every time we talk about this COVID relief fund, because I think those are the type of projects that are most likely to get approved.
How does someone go ahead to apply for funding? Is there a process through you or through the county?
Not yet. My guess is, and Kelly might want to weigh in on this too, because highways are another area that could be affected. But my guess is that as soon as our administrative team has a clearer idea of when the money will be available and what the guidelines for spending, they will make that fairly widely known. And at that point, boy, my guess, I'd just be guessing, so I'm not going to say. But again, now is the time to, if you've got uses or projects or things that you think might qualify, now is the time to keep those in mind, because I think there will be a time when the county will be calling for proposals and applications. Kelly, do you, highways might have a clearer picture of this. I don't know.
We haven't had that discussion yet. My assumption looks pretty much like what you're talking about, but it's not yet on our radar. I would guess that we will start talking about it at our next meeting.
Okay, thank you. Other topics to bring up or questions you might have? Comments, issues?
If I could use this time and space to just see with the businesses that are in the room today, if there's any desire for a closed pod or point of dispensing vaccination clinic at your site, I would like to know that so we can start those conversations. It typically takes me anywhere from 2 to 3 weeks to request vaccine. So we need to start the conversations fairly early. I know that many of our large business sectors have already consulted or contracted through somebody through Occ Health to come in and do vaccinations, but that's an option. Also, another option that is available, and I am very happy to be the matchmaker, is to have kind of a designated slot in one of the large mass vaccination clinics. So there are school districts and businesses that are en masse sending people over to Zorn and to Barron with some dedicated time set aside for employees or students. And so if that's something you guys are interested in, I'm more than happy to make sure that match is made.
Okay, thank you, KT. So we could look at possibly setting up another event like you were referring to locally? Okay. And people can go from one county. They don't have to necessarily be from Dunn County to attend. Okay. Thank you. So please get a hold of KT or contact her or the health department about setting up something at your site, or perhaps we'll publicize this and see if there's interest in going to some of the local business partners or health partners for the area. Thank you. Other things to discuss, other topics or questions you might have? All right, if not, we'll look at the next meeting, which Stephen was referring to in terms of the among other things, review of the plans. And I believe we'd be looking at June 17th. Am I correct on that, Stephen and Marie? If you're on mute.
Yeah, if that's the third Thursday, I don't have my calendar in front of me. At 9 o'clock in the morning, we'll try for.
Okay.
That's
So
what
if you
been
could,
customary. Yeah.
yes, correct. And we'll have this remote again. Is that correct?
Yes.
Okay. I'm looking forward to the day we can actually meet in person. I know KT's working on that, so thank you. But in the meantime, if you could set your calendars or at least block it off, and we'll send out an invite, and it would be for Thursday, June 17th, 9 a.m. So if you want to just kind of make a note on that. And we will send out an update. Other comments or questions before we seek adjournment? If not, my personal thanks to everybody on this call for helping to keep our community safe and secure in these times. So I appreciate everyone's efforts and your dedication and commitment to your families and our community. That means quite a bit. If we're able to have someone to make a motion to adjourn. Okay, thank you, Kelly. Is there a second?
I'll second that.
Thank you, Sheriff. All right, so moved. Oh, wait, we have to vote. Sorry, all in favor last time? I need my gavel here. There we go. We're good to go. So thank you, everybody, for attending and for arranging the meeting, Kristen and Stephen and Marie. Please be safe out there. Thanks, everybody, for your help. And if you have any questions in the meantime, we can certainly dialogue or communicate. If not, we will talk to you, if not